Firstly, what is edema and how does it occur? Edema is the movement of abnormally large amounts of water from the plasma into the interstitial fluid. It can also be an abnormal accumulation of the interstitial fluid. A buildup of fluid in the body which causes the affected tissue to become swollen due to the fluids inside. The swelling can occur in one particular part of the body or may be more generalized depending on the cause. Next, we are going to look at the role of osmotic pressure in edema. So the osmotic pressure gradient, which is a difference between the osmotic pressure of fluid inside the capillary and outside the capillary. When an osmotic pressure gradient exists, water tends to flow from the side where the osmotic pressure is higher. So this is determined by the protein concentration between the plasma and the interstitial fluid, because it will create a difference in osmotic pressure between the inside and the outside of capillaries. The osmotic pressure caused by protein concentration is also called oncotic pressure. So the pressure opposing osmotic pressure is called hydrostatic pressure. Because the concentration of proteins in the plasma is higher than the concentration of proteins in the interstitial fluid, the oncotic pressure gradient is directed inwards and it tends to drive water into the capillaries. In the case of edema, osmotic pressure is lower and fluid from the plasma is forced out into the interstitial fluid. Right now, I'm going to show you an example which will include osmotic pressure and hydrostatic pressure. We can see over here that the orange arrows here will show you the osmotic pressure, meaning that inside the capillaries there's a higher concentration of proteins, hence fluid will be forced inside the capillaries. But if fluid is constantly forced inside the capillaries may burst. So hence we have this hydrostatic pressure to oppose it so that fluid can be balanced in and out from the capillaries and also the interstitial space.
So now I will talk about normal fluid shift mechanism. This mechanism is actually responsible for maintaining blood pressure by the slow shift of fluid between the intravascular compartment and the interstitial fluid compartment. Capillary fluids contain gases, nutrients, and also waste are exchanged between the blood and body tissue by diffusion. Capillaries wall have tiny pores that allow water and small solute to pass between the pores into and out of the blood vessels. The capillary walls do not allow protein to pass through. There are two forces. One is hydrostatic pressure and then another one is osmotic pressure. These two forces will control the movement of fluid through the capillaries. So blood pressure, that's hydrostatic pressure, will tend to cause water to move out of capillaries, and osmotic pressure, which then will tend to cause water to move into the capillaries. At different locations in capillary space, the net forces will influence the directions of fluid movement. Okay, so now let's see how the mechanism works. At the arterial end, blood is under high pressure because it is just come from the heart. So blood pressure, which is hydrostatic pressure, which is higher than the osmotic pressure of the blood, will force the fluid out of the blood, leaving the solute behind. So this increases the solute concentration of the blood as the fluid moves out of the blood. At the arterial end, the blood pressure is relatively low because blood has been diverted from arterial to many capillaries. Osmotic pressure is relatively high, solute concentration is still high because fluid has been pushed out into the tissue at the arterial end, and what left behind the capillaries is a high concentration of solute that include salt, plasma protein, and also blood cell. Because osmotic pressure is higher than the blood pressure, Fluid move back into the capillaries and the blood become dilute once again. So about 90% of fluid that was pushed out due to hydrostatic pressure at the arterial end will eventually brought back into the blood system at the venule end through the osmotic pressure. The other 10% will meanwhile enter the lymphatic vessel.
Relation between edema and cardiovascular disease. One of the causes of edema is from heart failure. Heart failure is an illness whereby there's a decline in force of the heart's pumping action. Left side heart failure and right side heart failure causes a different side of the body to have edema. But how does it cause edema? This is the basic mechanism that you need to know. Reduced force of pumping action of the heart will cause the backup of blood into the blood vessel. This will cause an increase in pressure in that particular blood vessel as blood starts to pool in that area. Higher pressure in the blood vessels as compared to the body tissues will forces out fluid from the blood vessels and into the surrounding tissues. Excess fluid accumulated at the tissue area may lead to edema. Pitting edema, ascites, and right side heart failure. Pitting edema and ascites may be caused by right side heart failure. Both of these may occur when there's accumulation of blood in the systemic circulation. Pulmonary edema, pleural effusion, and left side heart failure. Both of these may occur when there's left side heart failure, whereby blood pools in the pulmonary circulation.
When there's a reduction in the pumping action of the left side of the heart.